Okay, today we're going to talk about how to do a simple interrupted suture. We have our skins with our incision. Before you start doing your suturing, obviously you're going to prep the wound site. I like to irrigate with normal saline in a syringe. Copious irrigation is always good. When you chart that, people always know that you cleaned it out, and that would just mean spraying high pressure water into this wound. Try and clean out any debris or anything like that. Obviously, before you do anything with this, you do anesthetize it with lidocaine or marcaine. When you select your suture type, you're going to want to choose a suture that's appropriate for the site that you're suturing. If it's a high tension area, you're going to want to go for a thicker suture. And suture thickness is inversely proportional to the number of the suture that you select. This looks like it might be a 3.0 or a 4.0. I don't know where it came from actually. I'm not sure what it is, but 3.0 is pretty thick suture. 4.0 is a little bit less thick. 6.0 is good for like faces. And then the difference in suture type. This is nylon, which means it's pretty tough. Silk has got a lot of benefits too. It's good and sticky. Vicryl is the kind of stuff that dissolves. Before you start, what you want to do is you want to size up your wound. I know already this is about an 8 centimeter wound. So the first time I throw a suture, I want to cut that wound in half. Okay? So the reason that I do that is because that means that I won't wind up sewing this closed and then having a bunch of skin left over at the end. So what I'll do is I'll eyeball the center of this. If I really needed to, if I was nervous, I could put my finger down and then I can measure it, or I know that each one of my fingertips is 2 centimeters, so I could put my fingertips down and I could say that's about 4 centimeters right there. I'm going to lift up the edge of the skin flap that I'm going to suture first with my forceps, and I'm going to place the needle in with the needle driver, and then I'm going to lift up the opposite side and I'm going to stick the needle through. Close the needle drivers around the needle on the other side, and then gather up the suture so that it doesn't get in the way. It's always good to control your suture when you're suturing. It's never good to have a bunch of suture laying down on the wound, or to have your needle flying around like that. Alright, and then I'm going to make a surgeon's knot for my first throw, 2 times around my needle drivers, grab the free end of the suture, okay, and then pull it through the loop. That makes our surgeon's knot right there. Put enough tension on it to approximate the wound edges, but not so much that they're bunching up. Okay. Now, because the free end of the suture started on this side and I pulled it to this side, the second time that I throw, I'm going to come back towards me and then grab the free end on the opposite side, going through the loop, and the free end moves to the opposite side of the wound again. To review that, remember that you want to place the needle driver parallel to the wound, and you always want to be tying perpendicular. You bring the suture towards the needle driver, across the wound. Each time you go across the opposite way. Okay. And after you've done about 2 throws, 3 throws maybe, you should be good to go. Just like that. Okay. Now that we've got that, we can cut it. And you want to cut it so that you have enough left over that after a scab forms, you'll be able to go back and find those suture ends, because you'll need to eventually take these out. These are going to be nylon sutures, so they're not going to dissolve from this wound site. You'll have to go back in about 10 to 15 days to remove those sutures. So now that we've got our first throw in, we're going to replace our suture in our needle drivers. And we're going to cut what's left in half again. Okay? Doesn't matter which way you go. I'm going to go this way. I'm going to cut this in half. And we're going to go in half. And then the other half. You always want to make your bites about equal on both sides. And that takes a little bit of practice. And better lighting would be nice. Okay. Again, gather up your suture so it's not going to get in your way. do 2 throws around for your surgeon's knot. Pull through. Okay. Come back the other way 1 time around. Good. Sorry about that. And again the other way. Back and forth, just like you're dancing. And then when you're done with that, trim it down. And we'll do 1 more, just so you get the hang of it. Now keep in mind that your suture length is going to get smaller as you go along, obviously, because you continue to shorten it every time you throw sutures. So you want to try and plan for that when you're suturing. Make sure you don't leave too much on the suture end. The free end of the suture shouldn't be too long. Otherwise, you won't be able to finish with 1 set of sutures. Good, just like that. Again, approximating the edges, but not putting too much tension that I might damage the delicate tissues that I'm working with. Good, just like that. And got plenty left over to come back and fish these out of the scab that will obviously be formed by the wound healing. Now, since we've gone through this process of setting these nice sutures in here, it's a beautiful job, obviously. This is like Picasso work here. So what we really need to do is we need to teach you guys how to take these sutures out. So you're going to count how many sutures at the end of suturing. 1, 2, 3. That was really hard. And then when the patient comes back 14 days later and it's looking real nice, you can say there's no dehiscence because the wound edges haven't separated. You don't see any pus, and there's no red streaking. It doesn't look infected. It looks like it's healing really nicely. And you're ready to take your sutures out. You count your sutures and you take them out 1 at a time, making sure that you don't actually cause a new incision in this patient. Real hard with these gigantic scissors. It's like play school scissors here. And there, that's how you do it. You cut 1 end of the suture, holding the rabbit ears so that you can get rid of it. And again, you want to count them so you know you've got them all. Just like that. Just like that. Look at that. And that is how you do simple interrupted suturing. Hope you enjoyed that.
Alright, hello guys. Here we are again to do another set of sutures. Since you guys have already seen the simple interrupted suture, we're going to show you something a little different called the simple running suture. It works a little bit like the simple interrupted, except that you don't stop and do individual throws. You're actually going to start the throws the exact same way, but then you're going to continue going and in a continuous way. So I'm going to go ahead and start the same way as before. You have your instrument and make sure you have your needle perpendicular to your actual instrument. So what we're going to do here is going to pull open on the skin a little bit and then insert right at the end of it, and then pull the other side and come right back out. Now when we come back out to do our first throw, we're going to do a surgeon's knot with the instrument tie. I'm going to go over 1, do 2 loops, and then grab the other side and pull it through. Then we're going to go ahead and put the instrument in the middle and go back over 1 time this time, grab it and pull it through the other way. You see, we're going to go that again, pull through the other side. You only need to do about 3 or 4 throws just to make sure that the knot is secured, but we don't want to pull it too tight. Alright, and then we can get our scissors and we can snip the end a little bit. Now, to continue with our simple running suture, we're going to go ahead and set up our instrument. So there's two ways in which we can do this. We can do it in a way that it gives us a diagonal with our clean suture, but for cosmetic purposes, most people that are getting the sutures done, they don't want to see diagonals. They want to see a nice horizontal set of sutures looking more like railroad tracks. So what I'm going to do is I'm actually going to go back into the original place where I first stuck the needle, and then I'm going to go underneath, and then I'm going to come out on the other side. Now what this does is it creates a little lattice work underneath that you do not see, but when we're doing it up top, you'll see nice little railroad tracks. So I'm going to set my needle again. Now when you're doing the second part, you want to go directly across so that you get a nice little railroad track formation. Lift up the skin, go inside, go at a 90-degree angle to the other side. If you can look inside here, you'll be able to see the needle inside, and then we're going to pull it back out through this side. Oh God. As we pull that through, you see a horizontal line right there. Set up our needle again. Same thing, we're going to go directly across to insert our needle. When we're doing that, you want to lift up the skin to make it easier. You go inside and you see how this needle's here, then you pull back on this side and pull it back out through this side again. And then we have another set of suture right there. Set up our needle one more time. Peel back the skin. Enter it. Peel back the other side. Now since this is going to be our last throw at the end, when we pull it out, we want to make sure that we leave a loop at the very end so that we have something to tie it with at the end. So instead of, this is a very small incision, but if I were to have this loop here at the end, I'm going to do an instrument tie but use this loop in order to close it off. So I'm going to loop here like we would in the instrument tie, grab onto this end, and then just pull it through like we would normally for an instrument tie. And then that will be nice and tight at the end. So then we do the same thing again, go in the other direction and pull that through as well. And then we do another throw, grab onto the loop, pull it through again. Just do it one more time. And then we can actually just cut the very end of it. And that should hold. Sometimes it looks prettier than that, but as long as you get your horizontal railroad tracks going, and then you can go ahead and cut this end off as well. And make sure you still have your needle on this side, and then you would have your simple running suture.